we are first and foremost here for the patient and for them to start their healing journey. And we do that in a variety of ways. And we have a variety of different supports and services that allow them to make a decision on what their healing path is going to look like. So we are most well known for our specialization in forensics collection. So we're known for the sexual assault evidence kits, and we have specialized training for with our nurses to be able to do that, but it's actually only a small portion of what we do offer. So we have medical treatment and follow-up. So we will see somebody in an acute situation, but we will actually follow them up to 6 months after that for any medical care, and that can be for any small injuries that we could potentially see, and then also the prophylaxis. So we can help to support with any antibiotics that they would need for any STIs. We support with HIV prophylaxis, Plan B or pregnancy prophylaxis, and also Hep B as well. We do documentation. We have counseling, we do safety planning, we refer to other community agencies. We offer primary care to those that don't have primary care already within the community. And we do consultation services with other professionals, and then education and presentations within the community. And we also support with contacting police services if that's how people would like to move forward. Our kits are offered as nominal, but then we can also do an anonymous option. So as you can imagine, when people are going through this type of a traumatic event, they often don't know whether they want to move forward with the police or with evidence collection. So we give the option of doing an anonymous kit, and it gives them the time to be able to think about how it is that they want to move forward. So we can keep that kit for up to a year, and that evidence will be sustained and will be fine to send in whenever they're ready to do so. So we have definitely had to change our model of care just during this time period. A sexual assault kit in the way that it was previously performed could take anywhere for 4 to 6 hours. So what we have done is really tries to limit the amount of exposure for both the patient and the staff member. So a lot of that we're actually able to do over the phone. So a lot of those risk assessments, a lot of that, the paperwork piece we can do over the phone. And then when we do go or have the patient come here, or if they already are here, we're only in the room or needing to be in the room to complete the rest of the kit. For it's about an hour to 2 hours that we're doing. And our nurses we're just here to respond. So we're just taking one call at a time. Each call is different, and we're here to support really whatever is coming through. So our motto right now is, pretty much just one call at a time. Well, you can never really determine a causal of domestic violence. So we can definitely speak to the fact that there are risk factors within our community that have increased. So such as it's very much the needed stay at home just to be able to protect the community from COVID-19. But we also have to examine what that increase in risk is for people that do experience domestic violence or sexual assault, that often are hand in hand, which a lot of people I don't think understand, because even people that are going through that experience feel that it's not really a sexual assault because it's their partner, but realizing that just because they have a partner, that doesn't make it that partner's right to touch them when they're not wanting to be touched. So it is an increase with people having to stay home and being in those type of environments. Home is not always a safe place for everybody. So it does make it a little bit tougher. And then you also have the heightened stress and anxiety that's just around the time that we are in right now. And that goes along with there have been layoffs, and there's financial stress and children being home, and there's just a lot of heightened anxiety around COVID itself. So I think all of those have probably supported the increase in the calls that we've had. So reaching out, and whether that is being able to reach out to us, we're here 24/7, so you can call any hour of the day to connect with us. If they are able to and it's safe for them to get out of the house, then you can come to the hospital at any time, and we will see you as a walk-in. And the stay-at-home measures and that physical distancing, um, it doesn't mean that you need to physically distance from when you actually need care or you actually need help. St. Joseph's is open, and we are here. So if it is safe for you to do so, then we welcome for people to come in, or reaching out to loved ones as well, if that's possible. I think one of the most important things that people can do is to just be there for that person and be there in a non-judgmental, supportive way. There's a lot of reasons why people are needing to stay in certain situations, and just being that person that they can go to whenever there is an issue or a situation is very important, for them to have that link in. So I think that's one thing that people can do is just be there and listen and support and encourage, for them to reach out, to different, community agencies that are there to help to support, and do have that specialized care that can help. Obviously, if somebody is hearing an escalated situation, that they are worried that somebody is going to be harmed, then we do encourage people to connect in with their local police services to help to support those situations. I think one, there are areas of where there are seeing kind of increased numbers throughout Ontario, but there's other areas of where we're actually seeing decreased numbers. And I think our biggest fear is that during this time, people aren't reaching out when they need to. And I think one of our biggest worries is that people are thinking we're closed, or that there aren't any supports in the community that they can go to, or again, they have that fear of COVID-19 and leaving their home. But we do have procedures in place and protocols in place to keep everybody safe, our staff and the people coming in. So we do, again, want people, if you need the care, please do reach out because we are here for you.